Good morning, afternoon, or evening to everyone wherever you are watching from. It is with great pleasure that I host this talk today. My name is JB De Chavez, and I am one of the project leaders for marine turtle conservation under LAMABE, and as well as the content creator of Sea Turtle Rescue Alliance. This is our third event of the Marine Turtle Medical Series, where we have the opportunity to learn more about the work that our colleagues from around the world are doing. In this series, we have a chance to learn about emerging issues and new techniques and protocols for sea turtle conservation. Before I introduce the guest for tonight, I would like to spend 2 minutes to talk about the Sea Turtle Rescue Alliance and its goals, especially for those who are joining us for the first time today. Next slide, please. The Sea Turtle Rescue Alliance was created to connect and empower the sea turtle rescue and rehabilitation community with the latest tools to improve the care and welfare of injured sea turtles around the world. The goal is to create a platform to share marine turtle medical information at the global level and provide essential clinical and training resources at the local level that have been unavailable to date. STRA will do this by promoting professional collaboration, share best practice clinical knowledge and data to enhance medical application to facilities worldwide, and support the global conservation efforts for all species of sea turtles. STRA does not intend to replace local and regional stranding networks, nor any of the existing databases, but to connect them and fill training and technology gaps where it is needed. Next slide. One of STRA's main pillars is to provide a platform for building and enhancing local capacity where it is most needed. This will be facilitated through providing online training and collating existing materials, including lectures, instructional videos, manuals, and quick guides. We are also creating a shared members-generated photo library to facilitate learning and diagnosis. The role of STRA is to facilitate the elimination of barriers, either medical, cultural, or economical. Often, online resources and textbooks are designed for medically advanced facilities and fully adapt to realities in new centers and most centers in developing countries. In collaboration with local partners, STRA aims to adapt training materials and protocols to local realities and local languages, taking in consideration, for example, local legislation, availability of medical drugs, and technology. To further facilitate learning, STRA aims to host regional workshops in collaboration with local and international partners and experts, spearheading the initiative virtually and as soon as possible, moving to in-person courses and workshops. Regional workshops will ensure local participation and will allow to tailor the training to local capacity levels and local issues. These series of initiatives, both online and in person, will foster local collaboration and the creation of a peer support network, the lack of which is one of the main barriers for professional growth in many regions. Next. This will also be supported as an incentive in countries where it is required by providing opportunities for continuing professional development. And since collaboration is at the heart of the Alliance, STRA will facilitate the creation of a network of training facilities that will be able to host students and early career vets, managers, and caretakers, and provide opportunities for exchanges and visits between centers, enhancing the role and impact of training hospitals and facilities, and providing opportunities for growth. Next. The Alliance, Sea turtle vets can play a pivotal role in sea turtle conservation, with our primary goal to treat the patient, rehabilitate, and release as soon as possible, giving the turtle the greatest chance of long-term survival. We can also cultivate awareness, create educational content regarding sea turtle injury and disease, and by promoting the role that sea turtle medicine can play in the conservation of these species, we can inspire further protection from the public. Through research and data sharing, we have the capacity to extend our collaborative research efforts globally. STRA advocates and participates in the One Health approach, whereby STRA is an instrument for zoonotic and emergent diseases surveillance. Next. The Alliance is open to everyone involved in marine turtle rescue and is based on an access tier system with privileges and responsibilities based on experience, qualifications, and commitment. If you would like to join, please find more information on the website www.seaturtlerescuealliance.org or on social media at Sea Turtle Rescue Alliance. Next. For this evening, our guest is a veterinarian at the Marine and Coastal Resources Research and Development Center, Central Gulf of Thailand. She takes responsibility for not just sea turtles, but also dolphins, whales, dugongs, and elasmobranchs, such as whale sharks and manta rays. She manages stranding incidences from rescue and response, rehabilitation, and necropsy, as well as sea turtle nesting and hatchling management. Apart from this, she also does various research such as satellite tagging of marine turtles, dolphin and whale surveys, and health assessments of wild marine endangered species. She received her bachelor's degree in veterinary medicine from Konkan University in 2012 and is currently taking up her master's degree in veterinary medicine, specializing in genetic studies in Kasetsart University. Her interests in molecular studies of marine species include paternity in marine turtles, haplotype in marine turtle and cetaceans, and genetic diversity of freshwater and marine Irrawaddy dolphins. Anyone who has questions can type them in and send them through the comment section of the Facebook Live at any time. Without further ado, here to talk to us about the sea turtle rescue in Thailand, status, case studies, and key players, please welcome Dr. Watchara Sakornwimon.
Okay. Okay. Can you see my screen, right? So, hello everybody. I'm Watchara Sakornwimon. Today, the first thing I would like to say thank you for the organizer that having me today. I'm very exciting now. And today, my topic is sea turtle rescue in Thailand. I will introduce you to know about the status of sea turtles and stranded sea turtles. And I will share some case studies in Thailand and who is key players in Thailand. So let's start. There are 5 species of the sea turtle that found around in the Thai waters, including green turtle, loggerhead, olive lily turtle, hawksbill turtle, and littleback turtles. But there are only 4 species of sea turtle that nest on Thai coastal, include littleback, olive lily, hawksbill, and green. Like in the Gap of Thailand coastal, there are only 2 species that they are green turtle and hawksbill that nest on the Gulf of Thailand coastal, such as Got Kram Island in Chonburi Province, Talu Islands in Prajop Khiri Khan, Chumpon Islands, Samui Island, Kra Islands in Nakhon Si Thammarat Province. For the Andaman Sea coastal, there are 3 species, include littleback turtles, olive lily turtles, and green turtles. The littleback and olive lily, they found the nest on beach at the Phang Nga province and Phuket province. Last year, I think there was littleback turtles laid out on Gatak beach. That is a famous beach in Phuket. For the green turtle, they has a nest on Similan Islands, Surin Island, and Pachai Islands. The most of the nest is from green turtle, around 78% of the all nest, and the second one is hawksbill turtle. In Thailand a few years ago, I think we have a new mother come to the beach and nest on a new beach, or the beach that never have a nest before or more than 30 years ago. This is a good news for the trend of the sea turtles population in Thailand. In Thailand, we have a sea turtle conservation that we call Her Majesty Queen Siliki Sea Turtle Conservation Project that established in 1950, 70 years ago. It's too long, right? She decided to she need to conservation for the baby turtle. We collect the baby turtles from the nesting area and nursery for 1 year. When they go enough, we release back to the nature, to the sea. Nowadays, this project take care of the long rehabilitate or or rehabilitate sea turtles too. So this graph is the forecast for the populations of the sea turtles in Thailand. We estimate from the number of nests. In the past, the trend is decline because of in the past around more than 30 years ago, we have a concessions of sea turtle eggs collection, and Department of Fishery introduced the trawling to the commercial fishery both, and we in the past we have an export for the sea turtles too, but the trend is decline like this. So we in Thailand, we have an act to protect the population of the sea turtle too, include Fisheries Act, National Park Act, Export and Import Act, Wildlife Reservation and Protection Acts, and this is a good news. Like 2 years ago, later back, it's a new Thai reserve animals. That is the law that protects the animals in Thailand. So this chart is show the number of strand sea turtle between 2011 to 2020. There were around 30 stranded turtles per year. It's a lot, right? But I need you to focus on 2017. This year we try to create the stranding networks in Thailand, and after that, we got the people to join our work, and announcement to the local people for where they can report when they got the stranded turtles, like both alive and dead. So we got many reports and many cases from that, and I think nowadays Thai people easy to to join the Facebook or social media. So this is the channel that can report the stranding case too. For the green turtle is the highest number of the stranded sea turtles, and the second one is hawksbill turtle. When you look at on the map, Phuket and Rayong is the most popular location that sea turtle strand. And by the way, the Phuket and Rayong province, we have a animal hospital for the sea turtles and marine endangered species such as cetaceans or dugong too. So I think this capacity to help the alive sea turtle when they strand. So this graph is show the status of strand sea turtle. Right? We separate in seven class. The first one is alive. Second one is fresh and decompose, advanced decompose, and skeleton. And some of them is lost, just like when tourists found the carcass, they report to the lifeguard. And when we go to the stranding point, the carcass disappears, something like that. So for the decompose, lost, decompose, advanced decompose, and skeleton, it's difficult to tell the cause of this, because when the carcass is decomposed, the lesions will gone, and you cannot get a sample for bacterial culture, viral culture, or fungal culture. So this status is difficult to find the cause of death too. So for the alive and fresh, or some of my decompose, we can identify the cause of death. So that's why the number of the turtles that we cannot identify the cause is so high. But for the identify cause, the highest number is sickness. Like a sea turtle will come to the beach with abnormal buoyancy, with algae or epifora, something like that, and sometimes turtle very emaciation. So we group them as the sickness. And the second cause is the fishing gear and marine debris. So now I will share some case in Thailand to you. The first case is belong to hydrocephalus in green turtle. This one is the first case report. That report by Dr. Virapong or Dr. Mac and his team. He was a vet in Rayong Center. So this turtle was a juvenile green turtle, was rescued from Lamsim estuarine and at Chantaburi province. The first time for the physical exam is show the turtle was mildly emaciation, floating, and intermittent anxiety, and she showed seizures, abnormal head position, and behavioral change. Like in the quick video, you can see the turtle cannot swim well, the buoyancy is not balanced, and it's easy to excite. From the neurological examination, it's revealed a left side head turn, bilaterally circling, and seizure-like appearance. So the turtle was sent to the animal hospital, veterinary hospital at Kasetsart University in Bangkok for check the serum chemistry, serum heavy metal contamination analysis, and CT scan and MRI. For the treatment plan, they just supportive care such as give IV fluid or like a feeding, maybe for feeding or intubation for feeding. And this turtle, the vet gave dexamethasone for like a steroid for the edema in the brain. So this is a radiology result. It shows dilation of the cranial ventricle and central canal, indicating hydrocephalus and cervical syringomyelia and low signal focal area under cerebral hemisphere. But sadly, after 2 weeks of treatment, the turtle dies and the carcass sent for necropsy. So for the histopathology figures display diffusely multifocal cerebral vasculitis, granulomatous meningitis, encephalopathy, and obstruction hydrocephalus, and have a lesion on lung and kidney too. In conclusion, the primary cause of hydrocephalus was originally by generalized vasculitis, which led to secondary bacterial infection resulting in granulomatous inflammation within in cranial ventricle. And the granulomatous mass caused an obstruction of CSF flow and increased the intracranial pressure, which result in the brain compression and neurological deficits. So this, and another case I want to present to you is about the marine debris. Effect of the marine debris on the sea turtles, I think, have two ways. The one way is entanglement. It's just like a ghost net or like a linear line that entangle the animals, and some of them like the triple like this, it's just like necrosis because of the entangled wool. And another way is the turtle can ingest the plastic, accidentally ingest the plastic. Sometimes we find from the necropsy, we find the plastic like this, include the net, the line, the small piece of plastic, the rubber ring, something like that. And for the alive one, sometimes we find the plastic in the feces too. When you find a plastic or garbage in the GI tract, it means in the environment that the people like the habitat contaminated with the garbage or marine debris. I want to show this case. This is a case that eat the garbage. This one is a hawksbill turtle, the strand in Pattani province. From the physical examination, it shows the turtle has a positive buoyancy disorder and emaciation. And you can saw the edema at the coegal and femoral fossa like this. So for the diagnostic plan, we correct the blood for hematology, and we bring the turtle to veterinary clinic for radiographic imaging. This is a plain X-ray. You can see. I think you cannot see the lesion, right? So we decide to give the barium for contrast. So these pictures take around 2 days, and we found the obstruction in the intestine here, and the barium cannot go through the lower part. So, but I think this is error of the technique, because if I want to do a CT scan, we need to do before we give a barium, because we saw the artifact or shadow like this. But at that time, the CT scan, we asked for the Songkha hospital that belong to the human hospital to do, and it show like obstruction around this part of the intestine, and like a stenosis of the intestine too. From the ultrasound, we found the gas accumulation too. So this case we refer to the small animals hospital in Chulalongkorn University, and we cooperate with VMARC, Dr. Nantrika Chansu. So we do surgery, and we found a lot of plastic that are stuck at that part. But after that, we try to do post-op, we give an antibiotics drug, we give a vitamin and fluid too. But the turtle show edema a lot, and the blood vessel is show hypoproteinemia. It means the water from the blood vessel weak to the third cavity. So after I think 4 days, this turtle died, and from the necropsy, the muscle is lysis, the liver is not good because of the nutrition is not enough for the turtles. So I want to talk about the plastic. We look at the marine debris. We can separate into groups. The first one we call microplastic. That the plastic that you can look by your eye, and the marine debris can come from anywhere. I mean, the people can drop to the sea directly, or drop to the river, or drop to the land. If you don't have a appropriate management, the garbage will go to the sea. And another type of plastic is microplastic. Microplastic can separate into groups. The first one is called primary microplastic, such as microbead or nanobead. But the second one is called secondary microplastic. That this plastic is break down from the microplastic to a small size. The microplastic is just like the problem under the mat, because the micro like a plankton can consume the microplastic in their bodies, and the fish or the seashells can eat the plankton. So it means microplastic can be in the food chain. Finally, if the people or human eat the fish or oyster or seashell, it's easily to get the microplastic and accumulate in your body. But I think we don't know about the effect of the microplastic now, but I think we need a time to know the result. Like in Thailand, I think before the pandemic situation, we can reduce the single-use plastic a lot. But during the pandemic situation, the people love to order the food from, not love, we must to order some food from the restaurant to home. So the food will in the plastic bag or in the plastic box. So we make more the plastic garbage. So I think we need to appropriate management for this garbage. The next one, this is the story of Omsin. Omsin, I think in Thailand she very famous because she is the captive turtle that found in Chonburi province, and she got some she had a corns in her stomach. The remark and veterinary faculty of veterinary science, Chulalongkorn University, that cooperate with Royal Thai Navy to help her. So this is her story. She was the female green turtle that feed in the captive pond in Chonburi province. And the pond built under construction, and she must move to Royal Thai Navy in Sattahip. And you can look at her pictures. The position is not good. Her buoyancy is not good, right? Because the bottom of her body is sink. It under the water all the time. It looks like she has a negative buoyancy disorder. So and we found a mass under her pastern. So she was referred to REMAC at Chulalongkorn University for surgery. So Dr. Nantarika got this case, and she do X-ray first. You can see something in her stomach. It's the opacity, and after that, she next step, the vet do a CT scan for her and saw it's like a foreign body in her stomach too. So they decide to surgery her when they do surgery. They found a lot of corns in her stomach. This is like a good luck corn. Like a people or tourists go there and throw the corns in the pool, and the turtle is accidentally eat the corn, and the corn is her stomach around 1,000 corns. It's so heavy. So that is the cause why she sink under the water all the time. This is a post operation. The West clean her wounds and use a laser therapy for healing, for wound healing, and she was put in the water for physical therapy. But sadly, I think around 1 week ago, she showed the symptom is not good. She a lethargy, not move much, and then she died. From the necropsy, we found intestine torsion and some heavy metal toxic. So this is famous case in Thailand, and very, very sadness too. Next case is belong to my center. This turtle is baby sea turtle in my center. He or she, I'm not sure, show the positive buoyancy disorder. It means they float all the time, they cannot dive, and she cannot balance her body. From the CT scan, you can see the lung is enlarged. One side is enlargement, is right lung is enlargement and gas accumulation like this. The cause of this disorder may be pulmonary disorder, such as pneumonia, pulmonary bullae, or other conditions, or neurological trauma or disease. For this turtle, I guess, because in the big pool, we have many baby turtle in there, and sometimes they swim very fast and like a drip, like a car drip, like a turn suddenly. So sometimes they hit to the pool wall too. For the treatment, I give the weight therapy, like for help her to balance herself, and use environment and nutritional management, such as the turtle put in the low water, because if the water is high, the turtle cannot balance herself. So when you put to the turtle in the low water, it's easier than the high water to balance herself. Next disease is uveitis with a corneal ulcer. For my experience, I usually found in strand turtle with the abnormal buoyancy. Like the turtles stay on the surface all the time. They got a sunburn on their carapace and dry, and eye will be dry. So you can see the corneal ulcer like this and prion like this is show you like this. For the osmosis method, I use the fluorescein straining like in dog and cat for look at the border of the ulcer. For the treatment for this turtle, the first thing I will clean the mucus around her eye with the artificial tears, and then I use levofloxacin eye drop around 1 or 2 drops and hold her head out of the water around 5 to 10 minutes, and then put her head back to the water. I do 4 times per I do like this 4 times per day, and the water is not high because she has like a sign like a abnormal buoyancy too. It's easy to drowning. And I gave her systemic antibiotic drug and supportive care such as IV fluid, vitamin, and for feeding. So next, about the fishing gear. For this turtle, she is a adult female green turtle that stranded in Samui Island, in front of the Navy base. In there, like the Navy found her in the water and pushed and brought her to the beach, and the Navy found the entangle. She has an entangle with a cat trap like this. So then someone calls me. I am in Chumpon, but Chumpon to Samui take a time around 5 hours. So the first thing we move her to the Samui aquarium first, and then we move her back to Chumpon. From the physical exam, it showed the body condition score is good. It's 3 from 5, and we found a deep entangled wound at the right fiber. It's like this, like deep to the hip to the humerus like this. When the entangled wound like this, it means the blood vessel will cut by the rope too. So it's show like a necrotic tissue at the lower part of the fiber. At that time, I didn't have a razor, so we asked to the merch company to provide the razor to us. The first thing that I do, like I give the antibiotics to and IV fluid and analgesic drug to her, and dressing and clean wool, and and then I give laser therapy like every 4 hours, and the result is quite good. In 6 days, you can see the wound is shallow, the necrosis is disappear, and the skin is continuing healing. The how to say the wound is closed like this. It's, I think the laser for me is good for the sea turtles. Mhm. This is another case that the cause of stranding from the fishing gear too. The divers found this hawksbill turtle in the Ngam Islands in Chumphon province. The diver found you can see the fishing line from her mouth. I, in my experience, if you want to catch the turtle in the water, it's very, very difficult. But the divers use many divers try to catch the turtle. Finally, they got the turtles with a fishing line like this. Body condition score is good. It's not emaciation. So this turtle was moved to my center. From the X-ray image, you can see this hook is too deep for manually move the hook. If the hook is around the neck, it's easily, you just put the hook, the tip of hook out and cut the parts. After you put the hook back and you can remove the hook from the turtle mouth. But that one is too deep. It's near the distal part of esophagus or near the esophageal sphincter. So we need endoscope. So we refer this turtle to animal hospital, Kasesa University in Hua Hin. Dr. Pong and Dr. Nat help us to do. This turtle, I use a generalized anesthesia for this turtle, like in-depth by propofol and maintain with isoflurane. It's a good, for me, it's a good protocol because the turtle slightly sleep, and when the recovery is very smooth too. But this turtle is lucky because you can see the bed at the tip of hook. If the bed is lower than this, it means the tip of hook very sharp and can make a wound at her in her esophagus. But the bed like here is easy to move the hook from, by endoscope. Okay. So for the entanglement, not only the fishing gear, it can happen in the marine debris too. If if the sea turtle got a wound like this, it means, like I say, the blood vessel will cut by the rope or by the line, right? So the blood supply cannot provide to the lower part of limb of flipper. So we got a necrosis tissue. If the flipper like this turtle need amputation. But for me, I don't like amputate the turtle because it's difficult to get back to the sea, and it need a time to adaptations for surviving. But if the cut wound is like this, it's fresh, it's easy to recovery. But sometimes we got the turtle like this, the fiber is go away, it's gone. Some turtles that lack of the fiber, sometimes they just show the chronic infection, and because when the fiber was cut, they lost a lot. They lost the blood will lost, and it's easy to infection to the bone, right? So the turtle will sick and get chronic infections and get anemia. So when they strand when they strand, it show many complicated sign or complicated symptom. But in Phuket center, we have some case that lack of the fiber like this. So now we have a project that called prosthetic fiber research that cooperate with a PMBC, Phuket Marine Biological Center, the MCR, VMARC, Faculty of Veterinary Science, Faculty of Engineering, Chulalongkorn University, PTT Public Company, and PTT Global Chemical Public Company Limited for create this fiber for health their quality, for help the turtle to have a better quality, life quality. But this one is under the research, under the study. So the next one is the tumor. If in US, I think the lesion like this is familiar like fibropapilloma. But in Thailand, I think this one is the first case that we found the tumor like this. This one is the adult female green turtle that strand in Chanthaburi province. She is a good condition and found a tumor like fibrobapillomatosis at the both eye. At the both eye and proximal part of the left front fiber. So this turtle referred to Kasetsart University for surgery. After healing, it's good healing. So the vet in Rayong collect the blood for health assessment and then release back to the sea. So now, last week I got a new case like this, but this one I don't know why the turtle have a tumor like this, and now the turtle still disappear. We have a surveillance, or we ask the diver on Koh Tao to search her for treatment. I hope we can find her. So the last case that I will share to you is a blood parasite. It looks like a blood parasite. I cannot tell you this one is blood parasite because we cannot identify the type of parasite. But you can find like the spot in the red blood cell, right? For the turtle that got condition like this, the vet will give her the subcutaneously inject 10 milligram per kilogram enrofloxacin every day for 2 weeks, and the spotlight will disappear. We found in Thailand, and I think 5 years ago we found in Malaysia too. So the last topic is about key players. I separate in 3 groups. The first one is government, the second one is universities, and the last one is NGO and local people. In Thailand, I think it's very important thing that we have a connection between government, university, and local people. For the government, there are 3 departments and one navy to join this work. The third one is my department of Marine and Coastal Resources. It's directly our work to take care of the stranded turtles. And another section is Royal Thai Navy. They have two center that do the conservation and help the stranded turtle. One of them is in the Sattahip Chonburi, and another one is in Thap Lamu Phang province. And another 2 department is our Department of Natural Park, Wildlife and Plant Conservation, and Department of Fishery. From my experience, 2 department is very very kind. Like we work together a lot. Sometimes we use the fishery pond to help the turtles, or they are the first responder to take care of the animals before we go there. So I want to talk to my department, the MCR. There are 7 research centers along the Thai coastal, include 5 centers along the Gulf of Thailand coastal and another 2 centers along the Andaman Sea. So this one is in Phuket Center of PNBC. It's called Silitan Marine Endangered Animals Rescue Center. I think this one is biggest center that do for the marine endangered species rescue in Thailand. So we separate into building. The first one is for the rescue building. Inside this building have many ponds, many pools for the strand turtles and for the long rehabilitation turtles. So we have another part that do laboratory and necropsy building. In this session, we have a surgery room, laboratory such as the hematology, histopathology, or something else to identify the cause of death or to do a research of the marine endangered species. This session is to necropsy. We have necropsy area and refrigerator for the carcass. So this is other centers. I think this is a good news in Thailand because the government have a plan to develop another center to be a small hospital, because some center is like a lack of their facility. So this one is in Rayong province, is the second big in the biggest center is in Phuket, right? But this is the second big of the hospital in the MCR. So we have a basic facility such as the X-ray, oxygen generator, but chemistry analysis. We have ultrasound and CU box for the turtles. So in Rayong province, they have some like endoscope or anesthesia machine, something like that to use for a live standing sea turtle. And for the Royal Thai Navy Sea Turtle Conservation Center in Sattahip, this is the big two, and they are kindly to help us. Like there are 2 vets in there, and they have a pool for the baby sea turtle and stranded sea turtle. Inside, they have a facility such as the surgery room, X-ray, CCU box, or endoscope too. So we work together to help the stranded turtle. So another part is belong to universities. There are, I think, like 8 universities to join our work, such as WeMark, Chulalongkorn University, Kasetsat University, Mahidol University, Chiang Mai University, Rachmangala University of Technology, Tawan Ok and Sivichai, Khon University, Walailak University, and Prince Songkha University. It's very useful because sometimes we lack of high, like a CT scan. It's difficult to use a CT scan in our center, but sometimes we ask for the human hospital, or refer to the veterinary hospital that belong to the universities. And sometimes like a turtle that I present you before, they have a complicated surgery, so we refer to Chulalongkorn or Kasetsat for surgeries too. they are a good, the best, I think the best partner for help the turtle. And this one is important part too. Like I say, we have a marine endangered species rescue training course for network, right? We do eight courses per year, and the number of participants around 280 participants per year. We do like around 5 years. So now we have around 1,000 participants that stay along through the along the Thai coastal. In this course, we teach the participant to identify the species of marine endangered species and know about how you rescue the life stranding. Like sometime in the past, when I got the stranded turtles that they are alive, um, the people put the oxygen into the water for help the turtles. But now we try to teach them what it's not necessary that you put the oxygen in the water, because the sea turtle go to the surface for breathing, something like that. And we got a lot of report from this network, and we got a good how to say the good partner to do to work as the first responder when we cannot go to the stranding area suddenly. So I think this network is very useful and very helpful too. So this is another partner. Some of them is NGOs such as Safeguard Down by the Sea, ไม้ขาว Sea Turtle Conservation, Do Gonggat on Libong Island, or Thai Whales, Trip Mongkon Whale Watching, Nogala School, Wild Encounter. They are a good partner as the NGO. They help us a lot about to like in my experience, Safeguard Tao will rescue the turtle that strand on Got Tao before I go there, because I take a time for go there. Or the human rescue team like this group, they have a knowledge to help the human. So it's easy to talk with them how you can help the animals when they're sick, or how you can manage the carcass before we go to do a necropsy, something like that. And we can connect to the local fisherman group, like right here, because I think if you want conserve something, you need to the local or stakeholder to join your project. It's the effective to to conservation, like a sea turtles or dugongs or whales. Okay, in my experience, I go to some beach in Thailand that the sea turtle go to nesting. I try to talk to the local people and get them a knowledge. That mean like some people show me like in the past they ate the egg turtles but not animal, something like that. It's a good way to protect the sea turtle in the future. So at least but not last, I will say thank you to my colleagues from the MCR that give a lot of photo, a lot of information to me. Dr. Kankamon Gitti Kamala, she is a veterinarian in Sea Turtle Hospital Royal Thai Navy that got a lot of information and picture too. Dr. Natrika Chansu and Dr. Thanida Hetagut from Weimar Chulalongkorn University that share the story of Omsin to me and help us a lot for save the turtle in Thailand. So in the past, I want to talk to Dr. Sontaya Mana Wattana. He was the first vet in the MCR, and he passed away last week. So He worked a lot for the he like he was the first vet, so he have many obstacles to help the turtles, to help the animals. So the thing that he work is planned to is help my team today. So I wanna say thank you, and he will be in our memories. Mhm. So thank you for your attention. If you have questions, please feel free to ask. Oh. ขอบคุณค่ะ
Okay, so thank you, Dr. Watchara. So the cases and the corresponding treatments you've shared are all very helpful, especially for those who are currently encountering or will encounter similar cases. So Thailand also seems to have a great network of groups doing both medical and non-medical interventions for marine turtle conservation. So it's really worth emulating. And we are sorry to hear about the loss of Dr. Santaya. I'm sure everyone in the network will really miss him. So, okay, we have a couple of questions. We have some time also for more questions. So if you want to ask anything, just feel free to post them in the comment section of the Facebook Live. But yeah, we have a couple of questions already. Let me read the first one. So, Dr. Watchara, what are the biggest challenges for sea turtle rescue in Thailand?
So so in the past, okay, I also as the how to say, in the past we have some belief about the sea turtles, such as some local people eat the sea turtles before, but the challenge is how do you change the belief? It's very difficult, right? Or some, like in Thailand, I'm not sure in the other country. Some fishermen think the sea turtle is enemy because some kind of the sea turtle eat the fish too, and sometimes they try to steal the fish from the fishermen. But I think the cost that we have another job, not only to give a treatment. We do a survey, we do nesting management. When we go to talk with the local people, we try to give them a lot of information, a lot of like a lot of information to them. In my experience, one thing that the local the old fisherman told me he ate egg sea turtle eggs before, and now he changed his mind to protect them. I think this is a good way to help the turtle in the futures. Mm-hmm.
Okay, so I think we have a lot of similarities because we also have fishermen in the Philippines that do the same thing. So you mentioned a while ago that there are some beliefs. So what are those beliefs in particular? Like, are sea turtles particularly lucky or unlucky when you encounter them, or something like that?
Okay, okay, in my experience, one time I go to got the stranding turtle that is a live one. You can see a lot of powder on their shell and with a golden pad on their shell, But this is a good way to them because they believe the turtle, if they release the turtle back to the sea, is long lived for them, it's good for their health, something like that. But some believe they use sea turtle as as the sacrifice animals. You understand me?
Yes.
You get it?
Yes.
Uh-huh. But now this belief is changed already. But in the past, it's just like belief. We need a time to explain, to change behavior, to change that belief. It's not it's how to say, this is the hard work for our biologists, the old one, something like that, to work hard for change, for do a lot of things for the sea turtle conservations. Mhm.
So, what are some of the things that you would employ? Like, for example, how do you change their thinking that turtles
Mm.
are supposed to be a sacrifice? Like, how do you change that mindset altogether?
Um, I I don't have experience or detail about that, but in the past, like we give another animals to them, like a chicken, to change that behavior with like is equal to do, you know, uh-huh.
Like, in
And
exchange for like a domesticated animal,
yes,
as opposed to an
and
endangered species.
yes, and we show the number of nesting. How like in the past, everywhere you can see the nest of the sea turtle, but now it's rarely to saw the mother come to the beach for nest. If the man that older than I think 50 years old, he get it. He get this point. Mm.
Wow. Okay, that's super interesting. So the next question is, what do you think can be done to improve the rescue and response for marine turtles in Thailand? Like you already do a
Uh,
lot, so how else can it be improved?
so now, like next plan, okay, for the training course, the most of participant is local people or the rescue guard or how to say lifeguard on the beach, right? But if we can expand to the children, to the like a veterinarian, local veterinarian, because the local veterinarian is the best way to support us. Like okay, like in my case, I stay in Chumphon, and it's far, and I take care 3 provinces, but the longest drive is around 6 hours. You can imagine it's too long for help the animals. If we can create the local veterinarian to help like as the first responder is a good way. And another part is around for the children. Some school invite us to join, how to say, to present to the children. I think this is a good way to help the sea turtle or marine endangered species in the future to conservations. Mhm.
Okay, so
And mhm. And in Thailand, I work only 8 years. I think I need more knowledge to improve our team too.
okay, so well, I guess that's why we have Strack. So we are all here to like try to improve and learn from each other. And I can see really a lot of
Yeah.
similarities between our countries because it's the same here. Like for where I am in particular in Palawan, it's a 6 hour drive away from the nearest center, which is in the city. So yeah,
Mhm.
we do have a lot of similarities, things we have to work on. Okay, so the
Uh-huh.
next question comes from Facebook Live from Joe Eames. His question is, what percentage of turtles are successfully rehabilitated and released?
I think more than 50%. I think. Actually, it depends on the condition of the sea turtles. Sometimes, uh, like uh, like I say, if the disease is not complicated, in my opinion, the sea turtle is the strongest one to alive. I used to work with the comatose sea turtles. Uh, how to say is prognosis is not good. Is to get sure for sure, but it can survive around 1 or 2 months before the turtle death. It's quite strong animals. Um, like I said, because of uh, we have a network, so in the past the percentage of the sea turtle that successfully is increased because we gave a knowledge to the people. Like we teach them to know how to help the turtles, hmm and include the citizens too. hmm
Okay,
More than 50.
so I guess a good follow-up question would be, if, for example, you are a normal citizen in Thailand, or if you're a visitor and you encounter a stranded turtle, so what should be the first or the series of steps that you should take in order for you to help increase the chances of survival for that stranded turtle? Like, what can people, local citizens, do to help in the response and conservation?
Okay. Like so I think we give a data that okay, like I said, like I talked in the past, Thai people don't understand the biology, the anatomy of sea turtle, right? They think the sea turtle in the water, so they look like a fish, but the turtle is not fish. Uh, the the way to help the turtle is quite different. So in Thailand, we for my department, we try to do like a flow chart or the how to say the book that easy to understand for the local people how to help. Like in the past, if the turtle eat the hook inside, they cut a they cut a line. It's very short. But now we try to change. We try to use like a YouTube or like a board to explain how you help how to help the turtle when you got this condition. That is very useful too. Mhm.
Okay, so yeah, for those who are interested, you can look for them in YouTube. So
Mm,
it's a really good resource for sure. And mentioning like ghost, well, fishing gears, is ghost gear also a problem in Thailand?
yes, absolutely yes.
Like what
Uh,
percentage of strandings, how much of it are because of ghost gears?
so I think like in the my presentations is I think around I'm not sure it's around 10% of stranding. I think I just estimate. Mhm. Um, because in Thailand we have diving point, many diving point, right? So we have a report from a divers a lot. Mhm. So we have a cooperate with Navy, with a local diving shop or natural park to to do to work on the ghost state. Mhm.
Do you have an idea where it's coming from? Like, are the ghost nets coming from local fisheries, or are they
Uh,
coming from international, or it's a mix?
I think it's mixed. It's difficult to tell because some area is far away from the coastal, you know, but some of them come from the local too. It's I think it's difficult to identify, but yeah, it can be mixed with the commercial and local fishery.
Okay, that's true. That's true. So, another question is, if I want to work with turtles in Thailand, what can I do? Like, do you have any advice for those who want to start a career in them?
For the career, I'm not sure, but sometimes we have a volunteer to join our work. Mhm. So we have many sections. I'm not sure for like in the center in the DMCR center. Sometimes we get the volunteer from the abroad too, and I think sometimes we have NGO such as Save God Tao. That is uh they work a lot of with sea turtles and coral reef. Mhm.
Do you accept both,
Yeah.
or do the groups accept generally both local and international volunteers?
Yeah, I think they do a volunteer, but they do a volunteer. But in my in the center in Phuket, like in the PMBC, you can like do a do a document or contact directly to the staff in there.
Okay, so Dr.
It'll be
Watchara was,
interesting.
yeah, so you were able to share a lot of the groups. You were able to mention a lot of them. So for those interested, you can just like rewind to that section and then you can take a look at the groups individually for more information. So there's another question here. Have you seen many cases of fibrobacteriomatosis in Thailand?
No, like I said, the
That
case
was the
that I
first
show
one.
you,
That
that
was
is
your,
the first one.
and you're
Yeah.
still looking for it until now.
Oh, really? In Philippines?
No, I mean, you mentioned a while ago that you're still trying to find that turtle because a diver saw
Yeah. Yeah, but we don't know this one is fibropapilloma, and I hope it's not because fibropapilloma can spread to the other sea turtles.
Yeah, it's really scary.
Yeah.
So we got another question from Facebook Live from Milk Chen. So the question is, to help the survival of baby turtles, some centers keep babies in the center and release them when they are strong enough. So what will this affect them to build the buoyancy skills? Is it okay to just keep them for a long time?
For the baby,
For
right?
the babies, yes.
Uh,
Like head
we
starting in general.
yeah, but we don't have sometimes like in my experience that a turtle that I show you that have a positive buoyancy disorder. This is only the case that I found. I never found a case like this before. Mhm. But some like a green turtle, in my opinion, they like a fighter. They bite a lot, uh-huh. And they like bite each other. They try to hurt each other a lot, but not like a hawksbill turtle. Uh, for some center that they use enrichment for help the turtle to reduce the stress or dilute the fighting. Mhm. That is okay.
Okay. So, well, in terms of recommendation, is it better to just release the baby turtles right away as soon as they're born, or is it really like, is there any positive effect if you just keep them for a while, let them grow out before releasing them?
For the babies.
For the babies, like for example, they just hatched from their eggs, because some centers,
Mm.
well, there are those centers that keep them. Is that advisable, or should they be just released right away?
So in my opinion, if the turtle is too small, it is difficult to survive in the nature because in the cost of they have many predators for the sea turtles. Um, if um, but you know, like sometimes the baby when the stranded baby sea turtle is if it's too small, it's difficult to survive. So when we move to the nursery, sometimes they get sick, and when the baby sick, it's difficult to give a drug or give a treatment, so it's quite complicated. Uh, some how to say some sometimes uh, we refer to euthanize the turtle, but in my like in Thailand, the people don't like to euthanize the animal, so we try to help. But some of them can survive and release back when they go enough around more than 25 centimeters of carapace length. Mhm.
Okay, so for
I think
this
it's in.
is yes, sorry. So this is for special cases only. Like for example, if the hatchlings are particularly small, especially compared to the rest of the batch. Yes.
Mhm. Um, you mean like for the baby, you wanna release suddenly or
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 keep
nursery them
first.
until
Yeah,
uh-huh.
I
For
think
me,
that's the
I wanna keep until they grow enough. Okay, the first thing that you wanna look at the pastel. If the sea turtle don't have a yolk or yolk at the pastel, when you release the turtle cannot survive because when they hatching, the turtle don't want to eat anything around 1 week. They swim straight, go to the open sea, and and stay in the open sea around 5 to 10 years because lost year. Mhm. But if the turtle that you get, the stranded baby turtles, don't have a yolk in their body, it's been they need to eat something during they swim to the open sea. It's difficult to survive, you know. The best way to help this turtle, you maybe go to the go to the nursery is maybe better.
Okay. So, well, one last question is, well, about the coins. Even that shocked me. Like, it's the first time for me to hear something about that. Like, having a turtle eat 1,000 coins is just shocking. So, how do you think this happened? And what's like the most, if that isn't yet the most shocking thing, what is the most shocking thing you've seen so far in sea turtle rescue?
The shocking
Yeah.
thing, I think Omsin. I think the turtle that eat the corns, it shocked me a lot,
So, how do you
you
think that
know.
happened?
Because they keep her in the pond as the tourist place, you know, and the local people believe put the corn in the pond. It's like it's a good luck corn, you know. And when people do something like this, another people do a lot. And when when the feeder give a feed to the turtles, some food is sinked to the bottom, and you know, like a green turtle, it just is herbivore. It's like a herbivore and animals because they eat sea grass and they grazing. So sometimes you can see the behavior, the grazing behavior from the in the in the green turtles. So that I think that's why they eat a lot of the corns from the ponds that they live.
Okay, so I hope that gets stopped before any more turtles eat more coins because that is
Yeah,
just really horrible.
I think
Okay.
this she for onsen, this is like the case that show Thai people that change their mind to throw the corns to the ponds, that the turtles, not only the sea turtles, it include the freshwater turtles too, to
Okay.
stop this
That's good.
behavior.
That's good. I think we need to tell other countries also who believe in similar, who have similar beliefs, like stop throwing coins in enclosures with animals in them because they can eat them. Okay, so that is all the questions that we have for today. Thank you so much for joining us today, everybody. And thank you, Dr. Watchara, for answering all of those questions and for sharing with us all of your very, very insightful knowledge. So, for everyone, please stay tuned for the rest of the series. We have a lot more coming up for you guys. So, just stay tuned and just view the Facebook and the website for more announcements. And if you have any particular challenging cases or are in need of support or you want to join the Alliance, please reach out to any of us personally or in our social media channels or go to the website so you can find out more. Then lastly, last slide, please. So again, we would like to thank once again Dr. Watchara for giving us her time and patience in answering all of the questions. So we would also like to acknowledge the groups that have been working to support STRA, including Ocean Care, the Olive Ridley Turtle Project, Loggerhead Marine Life Center, and Lamabing. So a recording of the presentation in both English and Thai will be available in STRA's social media accounts. So you can just check them out. If you've missed the first part, you can just rewind to that. So thank you and have a good day.